We have a different types category of body movement terms: angular movement, rotational movements, and special movements. Angular movement: flexion, extension, abduction and adduction, circumduction. Flexion: when we say flexion, we imply decreasing or minimizing the joint angle. Therefore, we may have flexion at the neck joint or hand flexion. Then we may look at extension, which can derive from the term extend and refers to increasing or maximizing the angle at the joint. So let's go through those joints one more time. Hyperextension movement occurs when extension at any joint is conducted beyond its usual range of motion. Hyperextension occurs when a structure moves beyond a certain point. Abduction: abduction is the movement of the body or structure away from body's midline or its midline reference point. Adduction: adduction refers to bringing back toward the body or the midline. Abduction and adduction of the arm or shoulder and fingers. The next one is circumduction. This action will produce a circular movement. Circumduction basically means moving the joint in a circle around its axis. There are 5 kinds of rotational movements. First, we have head rotation. Rotation of the head may involve left rotation and right rotation. It is the lateral movement of the head around its axis. This is also a rotational movement, medial and lateral movement. During medial rotation, also known as internal rotation or inward rotation, the anterior surface of a limb turns toward the long axis of the trunk. The reverse movement is called lateral rotation, external rotation, or outward rotation. The next movement will be the supination and pronation of the arm. This movement, called pronation, turns the wrist and hand from palm facing front to palm facing back. The opposing movement, in which the palm is turned anteriorly, is supination. The forearm is supinated in the anatomical position. This is the example of supination and pronation of my left and right arm. Special movements contains 11 movements such as inversion and eversion. Inversion is twisting movement of the foot that turns the sole inward, elevating the medial edge of the sole. The opposite movement is called eversion. Next is dorsiflexion and plantarflexion. Dorsiflexion is flexion at the ankle joint and elevation of the sole, as when you dig in your heel. Plantarflexion, the opposite movement, extends the ankle joint and elevates the heel, as when you stand on tiptoe. This is the dorsiflexion and plantarflexion of the right foot. Next is the opposition and reposition. Opposition is movement of the thumb toward the surface of the palm or the pads of other fingers. Opposition enables you to grasp and hold objects between your thumb and palm. Next is the protraction and retraction. Protraction is moving a body part anteriorly in the horizontal plane. Retraction is the reverse movement. You protract your jaw when you put your chin forward, and you retract your jaw when you return it to its normal position. Next is the elevation and depression. Elevation and depression take place when a structure moves in a superior or an inferior direction, respectively. You depress your mandible when you open your mouth, and you elevate your mandible as you close your mouth. The lateral flexion. Lateral flexion occurs when your vertebral column bends to the side. This movement is most pronounced in the cervical and thoracic regions. This is the lateral flexion of my head. This concludes all of the movement terminologies.